Hi there. I'm Malik, licensed acupuncturist, herbalist, and nutritionist. I've got my colleague, Daniel Woods, who's a specialist physiotherapist. He's amazing. He works for, or he runs a company called ptkids.co.uk. Basically, to be honest with you, if anybody sees him working with kids, okay, sees his expertise, his skills, and connection with the children, that sells it all, really. Indeed, that's the reason why I'd say I'd use it for my children. So let's introduce Daniel Woods. Please, Daniel, introduce yourself.
Hi. Yeah, thanks very much for having me on. Yeah, my name's Daniel Woods and I'm director of PT Kids and specialist children's physio.
Brilliant, excellent, lovely. So Daniel, what made you get into physiotherapy and pediatric side of things?
Yeah, well, as I went to study physiotherapy at university from school, and during my time training as a physio, I did a student placement in a pediatrics department, and it was that really sort of sparked my interest in the area and in the speciality. So during my rest of my time at university, I tried to tailor the learning wherever I could towards pediatrics. It just really grabbed me as a really rewarding area to work in. I think the thing that really struck a chord with me is that I do genuinely feel that there's quite limitless potential in a lot of the children and young people that we see, and it was that sparked my interest, and having the ability to change a young life or to help a young person reach their full potential. That was really what drew me to pediatrics and why I wanted to go into that speciality.
Brilliant, brilliant. I mean, if someone was to ask me why I went to acupuncture, I'd say not so about children, but I'd say it's exactly the same thing. You can make so many changes, catch them at the right time as well. But yeah, what you're doing is amazing. I've seen you work, and I got to sort of gain sort of like, give you a lot of credit, for what you do. And I think there's not enough of you people like yourself, enough of you out there to meet the needs. There's a massive demand, especially in the children's part of things. And over the many years of looking at, going in and out in hospitals from my own experience, not to bring anybody down. I mean, the NHS is a wonderful system or organisation, but it's like a big barge. It's slow to move, to manoeuvre. And and it has more and more paperwork, especially nowadays. Over the years I've seen, so I've seen less actual, real, hands-on helping kids, and more time, with the keyboard. So, and that's what they need. What you do is what they need. So that's brilliant. Thank you again for helping the community and helping children. So they really need it. They don't need more drugs, being honest with you.
No.
They need real good hearts and good expertise like yourself. So I'm sorry, I'm adding up, because I've seen you work and I know you do fantastic, and what you're doing is fantastic, honestly.
I really appreciate it. Yeah, thank you.
Now, coming back to what you do, what you specialize in neurological conditions. What are they? What it's a layperson that doesn't understand what these big terms mean. What does it mean?
Yeah, so we work, a lot of our work is with children and young people who have neurological conditions. So that might be cerebral palsy or acquired brain injuries or spinal injuries. So essentially neurophysio is sort of working with somebody who's got a disturbance to their central nervous system. So something that affects the brain or the spinal cord. Cerebral palsy is potentially the most common one. It's the most common cause of physical disability in children and young people, so affecting around 1 in every 500 children. So a lot of our work, particularly from a physio point of view, is working with these children and young people, because I think probably the key thing from my point of view is when you have neurological injury is early intervention. I think the good thing about working with children is they have neuroplasticity, so they have the potential to learn new things and create new pathways in their brains and create learn new movements. So really our job is to help them to to maximize that potential and work on that neuroplasticity and help them to learn new movements and learn new activities to help overcome their injury as much as they possibly can.
Brilliant. And I'm looking at your website, and I wish I'd known this many years ago, 10 plus years ago, 15 years ago. And you say that, these are the key things that a parent should be looking for. So, and one of the things is poor fine motor skills. Okay, right.
Mm-hmm.
Another one that hit me was clumsy, falling over.
Mm-hmm.
Now, I wish I'd known that, and I wish as a parent, I wasn't just relying on the NHS, to wave their magic wand and fix things.
Mm-hmm.
Because they have limitations, what they can do, whatnot. And I know you've worked in the NHS as well, and you do your private practice, and it's I mean, it's a world different between seeing someone operating from an NHS perspective. So I've seen both, you see, and from private practice, but there are some private practices that aren't very good, to be honest with you. I've seen them as well. So, and I'm not to want to bring anybody down. I always want to look for the best, to be honest with you. So that's where I come, the angle I'm coming from. I think people like yourself set the standard, and others should be chasing that level. So so brilliant. So come back to some of the conditions. So it's cerebral palsy. What about MS? Do you do help with that?
That tends to be an adult condition. So it's a degenerative brain condition, but it tends to affect people in later life, so in adulthood. So that's not something we're particularly.
Okay. So I've got one person in mind. Well, more than one, but a child, and she's, when I was asking for best fit description, they said it could be a bit of Parkinson's.
You see a very similar child.
Sorry?
I didn't quite catch that question, sorry.
Oh, yeah, sorry. Yeah, I mean, some of these conditions are a bit difficult to label. There's a bit of like a MS, bit of Parkinson's, bit of all of these things into an individual I have in mind. But yeah, that's why, and they all have motor issues, I guess.
Yeah, that's right. Especially, neurological system is really quite a complex one, and there's lots of different elements that make up movements. There's like flexibility and strength. There's also a lot of children we work with have what we call spasticity. So that's where the messages between the muscle and the brain are disrupted that cause the muscles to be tight, and we see that a lot in our children, or children who have shaky movements or perhaps clumsy movements. It's perhaps called ataxia, which is where a different part of the brain is affected. So I guess if you're concerned about a particular area of movement, I think it's finding the person that's got that specialist knowledge that can really understand all the different parts of neurology and movement and how they all interplay with each other is quite important. Yeah.
So as well as someone that understands it, you need to ideally catch them at the right stage as well. But that's not to say, I guess, that if someone comes across you many years later, that you can't help them then as well. Is that right?
That's right. Yeah, we work with all children of all ages and all stages of their condition. Children develop potentially the most between 0 and 5. When you look at a normally developing child between 0 and 5, they'll learn a whole plethora of movement skills, and then they start to refine them as they get a little bit older. But for our children who are perhaps delayed in their development, it's not to say that they can't then learn those skills later in life. We work with children up to around the ages of sort of 16, 17, 18, and there's still certainly a lot of movement potential that we can work on with those children that are older as well. So what the thing when they're a little bit younger is you've sometimes got less secondary complications to deal with. So children who are a little bit older might be a little bit tighter, so you've got to try and overcome that little bit of extra tightness that they've developed over the years, and as they've grown. When they're a bit younger, they tend to be a little bit more flexible. So there's a little bit more potential for movement there, but not to say that when they get older, they don't then continue to progress. And I think, one of ways that we look at things is we'll work on that neurodevelopmental element, but then we work a lot on strength training, but then we also look at like functional movements. So how does this child get themselves around? And I think probably the most important thing is really understanding what goals are important to that child and that family, and working towards those. So it's not so much necessarily about what I think is important to that child or that family, but the goal that they really want to work on. So a lot of our older children, they'll very much know in their own mind what it is that they want to work on and what they want to achieve, because they want to be able to get themselves around a little bit better, to join in with their friends a little bit more, or they want to be able to do something to have that little bit more independence and not have to rely on mum and dad quite so much. And when they get a little bit older, it's great to work on those sorts of things as well, and perhaps make them a little bit more functional and really focused around the sort of thing that they really want to achieve.
Brilliant. That's great stuff. Excellent. And so you have goals, and how long does it take to I guess, a set of treatment? How long will it take the parents to know?
Yeah, it's really difficult to say. I think one of the things about health is there's not so much a thing as a quick fix.
Yeah.
And although it sounds quite attractive to be able to say, you could change something very quickly and very easily, and there are some things where you can have a quick win, and some things can improve quite quickly, and particularly you can add a bit of extra strength or create reduce pain, or add a little bit of function quite quickly. More miraculous long-term changes happen over time, and it takes time to build strength, or it might take time to generate more flexibility. It takes time to learn new movements. And I think probably the thing that I feel like our families benefit the most from is when they work with us quite consistently and persistently over time. And I think between 6 months and a year, you can start to see very definite differences if you give it enough time. With the regular input, that's when you start to see the biggest difference. And I wish there was a quick fix in many of our things, but I think when you work in the health industry, you start to appreciate that it's all about helping the family to create new habits in their lifestyle and incorporating some of the therapy in their day-to-day activities. But the fact that we have the time and opportunity to work with families regularly, a lot of children we'll see every week for an hour a week, and that's a really a good amount of time to have some really focused therapy, and it's very hands-on. So that sort of length of therapy over a period of time, that's when we start to see the best results, when children and families sort of commit to a slightly longer term plan with their exercises.
Lovely. Excellent. Okay, great. So as well as the physiotherapy side of things, you also have something else you offer in your company?
Yeah, so we have occupational therapists as well, so a team of physios and occupational therapists. And occupational therapists, they look a little bit more at children's fine motor skills that they do with their hands, things like handwriting, but they also look at day-to-day skills or life skills. So it might be things like washing and dressing, or feeding themselves, or getting themselves dressed, and they can help with all of those things. But then a big area that we work in with our children with the OT team is children with sensory difficulties. So we work a lot with children who perhaps have Autistic Spectrum Disorder or sensory processing disorders, and our OTs assess their sensory systems and help put into place things like a sensory diet or strategies to help manage children's sensory behaviours, particularly for children perhaps who struggle to be in new environments or noisy environments. Perhaps they struggle with changes to routine. Perhaps they're sensory seeking, so they struggle to stop and concentrate on an activity for a length of time because they're always looking for sensory input, and the ROT team can help assess and advise on all those types of things as well.
Thanks. Excellent. That's pretty comprehensive. Another question I think most parents will be thinking back in their mind, especially the ones that perhaps can't afford private and rely on the NHS a lot, is cost. And I know you give tips to some parents as to how they can raise the funds for their treatment, don't you?
Yeah, we work a lot with various different charities, and we help families put together packages to look for fundraising for charities. So if a family wanting to approach charity, we can help perhaps put together a report to help justify costs for treatment. But we also work with charities such as Just for Children or Tree of Hope or Cordwell Children's, where families have approached them for funding for therapy, and we work quite closely with those. And we're always really keen to help support families if they're having fundraising events, or if they're hosting raffles or fundraisers, or if they're doing events. We're always really keen to help support those as well.
Brilliant, excellent. It's again, take my hat off the amount of stuff you do. Okay, great. So someone calls you for the first treatment. What can they expect on that first day for the child?
Yeah, so we're quite lucky. We tend to have the flexibility to be able to take children on within 2 weeks of a family getting in touch with us. So we can usually get them booked in fairly quickly. I always think, trying to get in there as quickly as possible is the best. You get the best outcomes. But when we go and see families for the first time, we want to take a little bit of time to get a little bit more background and history about the child and the family, and what's their story up to now. I think once we start to understand that, then we can start to plan their treatment a little bit better. And as I said before, it's understanding what their goals are and finding out what it is that they really want to help with, and what it is that they really want to work towards is really important for us to find out on that first appointment. So we are going to spend some time talking through those things. It's probably the most bit of talking that we do during the sessions, because after that, that's when it starts to get a little bit more intensive in terms of the treatment. But on that first session, we're going to do a full assessment of the child to understand exactly what their difficulties are. We're going to look at strength and flexibility and movement patterns, functional activities, a whole manner of different things to get a baseline assessment of where they are now, so that we can track and monitor their progress over time. We obviously want to try and make the input that we're having as objective as possible, so we can demonstrate the difference that we've made over time. So that initial assessment is quite an important baseline where we get a really good understanding of what the child can do now, so that we can then plan how and we're going to get them onto that next goal and that next thing that they want to achieve.
Excellent. Great. And what areas do you cover? I know you're north of the country, so what areas can you take points?
Yeah, we're a team. There's around 14 of us at the moment, and we cover most parts of Yorkshire, parts of Notts, Links and Derby as well. So we cover quite a wide geographical area. We sort of go up as north as Harrogate and down as south as Nottingham, and then out east as far as Grimsby, and west as far as Huddersfield and Bradford. So it's quite a big geographical area. And the team are all spread out in various different geological locations to help us reach as many families as what we can. We offer a mobile service, so we'll go out to see children or families at home or at school or nursery, wherever's the most convenient place for them, really, because we always find that children respond best when they're in their own environment, and when they can be happy and safe in their own environment. So we like to go out and see children and families out and about in their own homes or at their own schools.
That's brilliant, because a clinical setting is always a bit, for a normal adult, it's a bit funny, it's a funny feeling. For a child, strange people, strange place, but yeah, so it's brilliant. It's brilliant what you're doing there. Great. Okay, any final words you'd like to add before we wrap up?
No, I really appreciate you having us on. Kind words. We're really happy and open to hear from new families all the time. So if there's anybody who's not sure, they would just like to have a chat, or they've got some concerns, I'm more than happy to chat things over with families before they need to book an appointment, or to discuss if they think an appointment's necessary for them or their child. And I'm more than happy to talk to any families out there or parents who might have some concerns about their child.
Brilliant, excellent. And what are your contact details? I know it's ptkids.co.uk.
Yeah, that's right. So you can get me on email. So it's danielwoods@ptkids.co.uk, or all over social media. It's @ptkidsuk across social media.
Great stuff. And your phone number's on there as well.
That's right, yes.
Great stuff. It's been a great sort of having you on today, Daniel. It's, the work you're doing is amazing. You're helping a lot of children, and hope you help a lot more because they need it. Okay, great stuff. So thank you very much, and hope to see you again.
Brill, thank you for having me.
Thank you. Just don't go away.